24-year-old young gentleman here who's coming in. He has some receding in his corners, and we're going to kind of try and stay one step ahead of this and kind of start filling in his corners and hope that he doesn't have a lot of further hair loss in the future. He's got really good donor. I would say as far as donor density is concerned, he's above average. In my opinion, on a scale of 1 to 10, where 1 is bad and 10 is the best and 5 is average, he's probably about a 7. Okay, as far as density, hairs per square centimeter. And they're very straight and they're all in the same direction. His colic is up higher here, so when it comes to doing FUE, it should be a little easier because a lot of his hairs are all in the same direction. Okay, so now what we're going to do is we're planning a 15 to 1600 graft case, or 7 to 800 grafts per side, and we are going to just kind of draw out these corners and kind of figure out where we're going to put the hairline. Now, we met once before earlier, but now we're meeting again the day of surgery, and I told him that his center point here is actually a little lower than the average. The average adult male is about 4 fingers from the eyebrows, and that would put him up in here. So we're going to kind of make our hairline from about here. We're going to leave these little hairs that he has out front of the transplants, because anytime you can have a group of original hairs out in front of any transplant hairs, that only makes it look more natural. Plus, there's a good chance that this is going to recede. This little bit's going to come out, and then we're going to have his permanent hairline be at a more appropriate location that'll look appropriate for his age now and appropriate as he gets older in his 50s and 60s. Okay. When I look with my loupes, I can actually see some remaining hairs that are still left over. These are remnants of where his original hairline was. So it's pretty easy for me to kind of do almost like a little dot to dot, just to kind of put it back almost the way it was. The only thing I see on Eddie is he does have a little temporal recession. Now, did we talk about his temporal recession when we saw him last time?
I think he yeah.
Yeah. So I think he has a little bit of recession here also. So not only has his hairline crept up this way, it's also crept back in here in the temples. So I think it looks a little more natural when you do a little bit of restoration in each area. So basically what's happened is his whole corner crept back, and now we're going to push it forward. Instead of both areas creeping back and then only fixing one, we're gonna fix them both. So we're gonna make his forehead a little bit smaller this way and a little bit smaller this way. Okay, this is you're only talking about maybe a half a finger's width or a finger's width of work, less than a centimeter, and this is a difficult area because, as you can see, the hairs are angled very flat against the skin. So when you're making the incisions, it has to be almost flat, straight up, so that when you slide the graft up and in, it grows flat against the skin. This is critical. You cannot have incisions made in this direction that stick out. It's very difficult to control. So this is a very difficult part of the surgery. So I'm going to eye this out as best as I can for now, and then what we're going to do is we're going to start doing some measurements. And we're going to take some tools that we have to make sure that we're about as symmetrical as you can be. I like to use the term relative symmetry, meaning I think the hairline should look symmetrical when you look at it from the naked eye, but there should be some degree of variation along the hairline. There should not be perfectly straight. So I almost like to even show the patient almost a little bit of a zigzag line, just to show them we're not going to put grafts just on a straight line. There has to be some grafts that are on the line, behind the line, in front of the line, and there's a pattern to it. So I think that's a critical point, and then we're gonna bring them a little forward here also. So, Eddie, tell me what you're thinking. Are you thinking this is kind of what you had in mind? Okay. So what I'm gonna do now is I'm gonna do some measurements. I'm gonna use a couple different tools here that I use to determine if this is, relatively symmetrical, which it is. This little device here can determine the midline and like a perfect arc. It's almost like a tool you'd use to hang a painting, a laser beam that shows you that it's very even. Okay, so we use all these tools to make sure that we're not missing something because we're using our just the naked eye. I also like to take a tape measure and make sure that this corner that I'm creating is the same distance to the corner of his eye on this side as it is this side. So there is a little bit of a method to this, just to make sure that our numbers aren't skewed. And I don't push very hard, and we're looking at about 9 centimeters from the corner to the corner of his eye. Okay, and I'm going to come to this side here also. Exactly 9 centimeters. So this I think we're relatively symmetrical here, and we're going to do the majority of the work, the bulk of the work today, or almost all of it, I should say, is going to be right in these corners. Now we're going to come back into these areas where he's thinning a little bit and do a little bit of grafting, but you can't do too much grafting in an area that has that much hair. It would only cause hair loss. I don't think you would get any kind of net gain there. So, and hopefully he won't have too much hair loss in the future. And if he does, he realizes maybe he'll just come back, years from now if he needs some more work done. But if he's anything like his dad had some hair loss also. We did a procedure on him, and it's lasted 10 years, and he hasn't had to come back. So hopefully he's in the same position as his dad. But I think this is perfect. You okay with this?
Yes, sir.
Okay, yes. So good. Okay. So now we're going to go into the surgery room, and first thing we're going to do is we're going to buzz this down, just to get it to the proper length. He has this buzz, it has to be a little shorter than this. The same area that he did his buzz cut, we're just going to buzz it a little lower, okay? And then we're going to do the local anesthetic, okay? I have to we use a little bit of lidocaine, and I basically do a circle around this area there. That takes maybe 3 or 4 minutes, and then I do a little line along the hairline, and that takes about 2 or 3 minutes. So we're looking at about 7 or 8 minutes of anesthetic. It does sting a little bit. It's probably the worst part of the surgery. That's the only part of the surgery where there's going to be any discomfort. And we use the same thing they use when you go to the dentist. It's the same anesthetic, same tool, same needle, same everything. So it's really tiny. Once I have them all anesthetized, then I'm going to make all the little incisions first. So I'm going to take these little handmade surgical blades, and I'll show you how I make them, and I'll show them to you before we use them. I'm going to make all the little incisions, the 700 or 800 per side. Then we're going to take them into the room where the smart graft is, and then we're going to do the extractions. Once we get all the extractions out, we put them back in the original room, we put the grafts in. Okay? All right, so we're gonna be ready to go into the next year. You ready to go?
Yes, sir.
Okay, follow me, and we're gonna head in.